So use this screencast to help you as you go through this material, to help the material come to life for you. So in the last video, we introduced you to the whole area of ethics and really looked at the areas that we're going to be looking at in this term. So I think it's important to just talk about what is a professional and why it's important to have this conversation. Essentially, a professional is the physical therapist. Physical therapist carries with them these four characteristics. They have advanced expertise in body systems. They are able to exercise independent judgment in terms of creating a plan of care and establishing physical therapy goals for the patient, and to make changes regarding the plan of care at any time during the course of treatment. They belong to a professional association. And this is important because there are many therapists that do not belong to the APTA. In fact, over half of the PTs and well over half of PTAs do not belong to the APTA. And so it really is difficult as far as a wordsmithing to embrace and just call yourself a professional if you do not belong or not part of your professional organization. And we'll talk about PTAs as professionals in a little bit. And then that commitment to the public good, that overall it's about what's best for the public, and to have that characteristic of service. Now, it doesn't mean that PTs shouldn't be making money. It doesn't mean that PTs should be living in poverty and should be giving everything up to the public good. However novel that is, and however altruistic that is, it's not realistic in the lives of people that have to provide for themselves and their families. Now, with that to be said, though, I think there's always that conversation about, is it right to make a lot of money off of patients and to do quite well professionally as a PT, and maybe to some degree as a PTA if you have your own private practice or owning several clinics with a PT or by yourself as a PTA or a part of a larger group. Those are good questions. But I think overall there needs to be that pro bono aspect. And Gabbard, who's I reference quite a bit here from time to time, is a physical therapist who teaches ethics at Chapman University in their DPT program. He really talks about the importance of pro bono, that there is some aspect of what we do that is for the public good that we don't get paid for. And that doesn't mean that we're providing charity. It's a fundamental part of our practice, but it needs to be part of our practice. And whether that is volunteering at a charity event or from time to time the PT making the decision to see a patient without charging them any money because they don't have any money. And that is, I think, another aspect of what it is to be committed to the public good. And I back what I say up by Gabbard, who is an expert in this area in terms of ethics. So our role as a PTA is support the professional, and that is really important. That doesn't mean that we have to certainly be blind, and if things are not correct, or if a PT makes an omission or overlooks something, it is our role to support them in a positive way, to just bring to their attention, you know, I've noticed this. I just wanted to bring this to your attention. And an example of that would be a PT I was working with, who's probably one of the smartest people I know, developed a plan of care and included ultrasound in the plan of care of a patient that has had very recent cancer history, very recent, and wasn't currently in relapse, but had been in a relapse very recently. And so he talked about that, and the PT was like, whoa, I did not pick up on that. Thank you for picking up on that. So, you know, that was the individual patient, you know, who had several other health conditions as well. So, you know, I think, you know, sticking with manual therapy and appropriate manual therapy for this patient was appropriate, and some cold as a modality because of the shoulder problem. There was an issue around impingement. That was appropriate, but ultrasound, we decided as a team, the PT was not appropriate. So that's, our role of supporting the PT and not being blind. In other words, having conversations that are respectful in tone and in just overall the goal of supporting the PT. So what are our roles in terms of what the PT is doing? Our role is to support that plan of care and to really help get that patient to buy into the plan of care. One of the ways that I did this as an outpatient was I would appropriately and at the appropriate time chat up the PT. The patient sometimes will have questions. Is this going to work? I'm not sure if this is going to help my shoulder. And what I would say to them is that, you're working under a fantastic PT. This PT, who I worked with several, but I'm just going to use the name Lori, has advanced training in shoulder rehabilitation. Her patients do well. The outcomes are positive. You're in good hands, and this will work. I would say I can't guarantee it's going to get you everything you want, but it will help you on your health condition. And I was honest. That was a true testimonial to what this patient's health condition was. It wasn't, if ever a PT is like, I'm really not sure this is going to work, Mark, they were always honest with me and had that discussion with me, and they generally had that discussion with the patient already. They said, we're going to give this a trial of 4 or 5 visits, and if we don't see an improvement, we'll probably going to send you back to the doctor, for example. So that is important. And that's part of eliminating the barriers to patient participating in the plan of care. And just to be, this is what I'm talking about. Sometimes in a real busy clinics, the front door can be a barrier if they're not getting good customer service. Sometimes that language communication barrier between you and the patient can be a challenge, especially if there's not a solid interpreter helping bridge that gap. And then certainly preconceived notions about people can really be a barrier. I'm talking about kind of the era of, another example of recent history was 9/11 and how Muslims in the community where I was working had been under increased prejudice from providers because of that event and the subsequent wars that happened. We see that prejudice even continue to manifest itself to this day. So prejudice exists and can affect even people that you would think wouldn't be prejudiced. And there's a whole slew of reasons why that occurs. Some of those go way back to childhood, and some is just, unfortunately, just misinformation that's put out there about groups of people that is just, frankly, false and disingenuous. So, I'm including these last things. I had some other barriers in patient participation in the plan of care, but then finally, these discussions on conflict of interest, and I want you to bring your answers to office hour if you can, if you participate in the office hour, and we'll have a conversation about these 2 conflicts of interest.